those numbers still going up. All right, welcome everyone. We are very pleased to have you here with us today for our webinar on asthma confusion, how to use inhalers, spacers, and nebulizers. I'm Dr. Zan Novakovsky. I am the evaluator for the Florida Asthma Program and Coalition, and it is my pleasure to introduce to you today our presenter, Andrea Jensen, who is going to talk to us today about inhaler technique. Andrea is a certified asthma educator, but she switched careers from interior design to public health after she and all three of her children were diagnosed with asthma. She went back to college for another degree, this time in public health, and now she's a certified asthma educator and a certified health education specialist. She founded the asthma program at the Utah County Health Department in 2009, coordinated an asthma home visit program, and provided guidelines-based asthma education and environmental intervention education. She has presented nationally at asthma conferences and been published in peer-reviewed journals, worked at the national level for Allergy and Asthma Network, and is now working as a consultant. She's also chaired the Utah Asthma Task Force, served as president of the Utah Society of Public Health Educators, served on the executive board of the Association of Asthma Educators. She authors an award-winning blog, My Life as an Asthma Mom, which you can find the logo for in the lower right corner of the intro slide. It's a pair of blue lungs with the little airways represented in a darker blue. And she shares accurate information from reputable sources about asthma management on her blog. She's also a content developer for asthma.net. So I'm going to give the floor to Andrea, and we're going to try to leave some time for questions and answers at the end. So please hold your questions until the end. And if you want to type questions in the chat later, I will read out your questions, or you can unmute and ask out loud. We'll call on people.
Thank you, Zan. Buckle up, because I have a lot of information to share and I will be talking fast to get through all the slides. But remember, this is being recorded, and you can also access a copy of a PDF of the slide deck, which was just updated this morning, hot off the presses. So let's categorize what we'll talk about today: different types of inhalers, different types of spacers and holding chambers, different types of nebulizers, and then at the end we'll go over a little bit of information of how to help people if they can't afford their inhalers, or really any other medication for that matter. So who feels like this? When people start talking about asthma and you have all these different types of asthma and treatment plans and options for inhalers and nebulizers, and it can really be a lot of information all at once. It's like drinking out of a fire hydrant. So this is a great option. I want to throw this in at the beginning. This is the latest poster from Allergy and Asthma Network. It's updated, and what they did this year is they included the nebulizer medication in the same category as the inhaler, the same type of medication. This is a great option for some of the people that have toddlers, or maybe some of the older folks that need to nebulize their medication instead of using inhalers. They don't have the generics on this poster, so I've thrown a couple up here. This is my generic inhaler. They may look different colors than generic for albuterol. There's one on the left side as well. Keep in mind, some of these generics are a little different. They might have the counter in a little bit different spot. So this one, it happens to be on the top. This one, it's on the front. Counts down by 20, which I'm not a big fan because it's a little bit harder to keep track of dosing, but there you have it. So we'll talk about different types of inhalers, and as most people know, there's different delivery devices. So we have our meter dose inhalers, our MDIs, we have our dry powder inhalers, DPIs, and then soft mist inhalers. So these are the most commonly seen inhalers because these are the quick relief, the reliever, the rescue medications. Unless you live with someone that has lung disease, you probably aren't going to be seeing some of the other inhalers. You may see this most, especially if you work in a school, maybe a school nurse or something like that. These are all meter dose inhalers with the exception of this little guy, or actually he's kind of a big guy. He's like a fat little chunky version of an inhaler. This is a Respiclick, and it's a dry powder inhaler. One common myth I wanted to touch on today is some people think that albuterol is addictive. It's not addictive. It's there to help you when you're having symptoms. Your doctor has prescribed it and has advised you to use it if you're coughing, wheezing, short of breath, you have chest tightness. That's what it's for. Go ahead and use it. That's what it's for. You will not be addicted to it. This is the new kid on the block. They call it the new albuterol inhaler, but it actually has an added bonus. This is a one-of-a-kind medication. This is the first time it's been on the market in the US. Really excited about this. It's a two-in-one quick relief inhaler because it also has a corticosteroid in it. It also has the budesonide in it. So this is for ages 18 and older. Uh, this is just approved by the FDA, hot off the presses. I've heard some people say they're having a hard time finding it. I didn't have a hard time. My insurance covered it. This is mine. My daughter has one. A friend has one. So this is a great option for some people that don't need to use a daily controller inhaler. My oldest son, who's 30, I don't know, 33, I think. Um, he doesn't use a daily controller inhaler. So when he has a flare right now while he's sick, he's using this. He's getting albuterol, but he's also getting that little bit of inhaled corticosteroid, which is going to help that swelling in his lungs. So really excited that this is on the market. While we're talking about inhalers for schools, just hopefully you all know that albuterol self-carry laws are available in every state in the US. There's a condition there. You need to fill out a permission form at the beginning of every school year. And this must be signed by the physician, the school nurse, and a parent or guardian saying that this child knows how to recognize asthma symptoms, they know what to do, and they can self-carry their inhaler. Obviously, you probably don't want a little kindergartner carrying it and goofing off with it, but do know this is law in every state in the country. And there are a lot of states that have stock albuterol laws as well. What that means, you can see the states here that are included. So they will have an inhaler at the front office along with a disposable spacer. So if a kid forgets his inhaler, he left it at home, he's having a flare at school, he can go to the front office and use that. So if you don't have one of these in your state, maybe that's something to work on. I know American Lung Association has done some great things on making sure that people can get these in their states. So I did have a request to talk about smart therapy, which is now called MART therapy. There's so much in my slide deck. I can't really go in depth in this, but we'll just do kind of a 25,000 foot view of what's going on. So as you can see, it's called maintenance and reliever therapy. I've seen that this is really slow to be adopted. I've talked to some of my doctors, I've talked to pharmacists, kind of slow picking up on the theory behind this. But let's break it down. What is smart therapy? So traditionally, pick a controller, any controller, or really not any, really what your insurance will cover. And then you would pick a quick relief inhaler. And generally that was your asthma treatment plan, unless you're also on a biologic. So now here's what you'll use, ages 6 and up. Ta-da! One inhaler. So you will use that for your controller inhaler. So a puff in the morning, a puff at night, and then you will also use it during the day if you're having symptoms. So let's take a look at this. So here's the science behind this. When I first saw this, I thought, how is this possible? How does this work? So formoterol has a rapid onset that's similar to albuterol. Here's a graph from a study in PubMed. And if you can see this very bottom line with the squares on it, so that's salbutamol, which is what they call albuterol in Europe. The line right above that with the little circles on it, see, it's almost an identical arc. That's budesonide and formoterol. So the studies have shown that it's as effective as albuterol. So what does that look like? So it can reduce airway obstruction and provide that rapid relief. And this has been actually proven by doing pulmonary lung function tests that it can be used as in place of albuterol. So this is going to be a major shift in thinking. How are you going to change your thinking? Because you're used to having two inhalers. And really, most people mix them up. They can't remember which one they take in the morning, which one at night. I know this from running my asthma home visit program. I put little stickers on there for people so they know which one is which. So this may be helpful for people just to have the one inhaler to use. and tell them it's going to be your new inhaler. Use it as your controller and your reliever. Naturally, people are going to be suspicious. I was as well. I actually tried it out. I was exposed to something, set off my trigger. I tried it out using the formoterol and budesonide. It worked. It actually worked. And you can also use it to pre-medicate. So if you're going to visit Aunt Gina and with her 16 cats or whatever it is, you're going to a friend's house and they're a smoker, whatever it is, you need to pre-medicate, you can use it for that as well. So how's it prescribed? Children ages 6 and older, a child with moderate to severe persistent asthma takes it normally 1 to 2 puffs morning and night, and as needed to treat sudden symptoms. I have here in the red, the maximum for this age group is 8 puffs. For adults, it's 12 puffs. Similar, take it as your controller, use it when you need to, 12 puffs. So when doctors are prescribing this, this is considered off-label. So there have been a lot of issues with insurance companies covering this. You may go to get a refill and the pharmacy says, it's not time yet. You can't get it refilled. It hasn't been long enough. So still a lot of bumps in the road to smooth out for this. Something else you may all have heard about, Flovent being discontinued last month. There is a generic available, but that doesn't mean that it's less expensive. In fact, when I had to go get a generic as an add-on when I had COVID, it was $200, and that was my copay after insurance. The other problem is insurance companies do not have this listed as a preferred medication on their formularies. So doctors are spending a lot of time trying to submit a prior authorization. That's really taking a lot of time away from patient care, and it's really been a big problem. Also, if it's listed as a tier 3 medication, whether it's a generic or another inhaler, patients are going to pay more. So here's a couple of options. These are similar to Flovent. It's fluticasone propionate, different brands, but as I mentioned, if they're not listed on the formulary, they could be paying a lot more money if you can actually find these. I just read an article about a group of doctors across the US that are really struggling to be able to get an alternative for their patients. So these are also corticosteroids. However, these are dry powder inhalers, and there are age limits on this. So I've put these down at the bottom in the red, 4 years and up, 4 years and up, 5 years and up. If you got a 3-year-old or someone that can't have the inspiratory rate that they need to use a dry powder inhaler, this is going to be a problem trying to replace Flovent. A couple other options, same thing. Here's Pulmicort, that's 6 to 17 years. So if you've got a younger child, that's going to be a problem. Same thing with QVAR. So this is going to take a while to shake out, I'm afraid. So do you really have the inspiratory rate needed for an MDI kit, or with the meter dose inhaler or the dry powder inhaler, whichever one you're using? Make sure that you have one that you like and you will actually use. So true story, I was on vacation. I was in Hawaii. I was at a luau. I have a seafood allergy. I don't trust anyone. So I was checking the buffet for seafood, and they had seafood that was not labeled. Staff member came up to me and she said she also had a seafood allergy as well as asthma. We were chatting about that. And she said that she uses her rescue inhaler 5 to 6 times a day, every day, which is incredibly dangerous. So I asked her if she had a controller medication. Said, oh, I have that purple disc. I just really hate it. And I said, oh, pulled up my cell phone because I always keep a poster of the inhaler posters on there. And I said, you can get the same thing in an inhaler form. And she said, really? I said, call your doctor, see if it's covered, see if you can switch. I really hope she did, because what she was doing was really, really dangerous. So bottom line, make sure that you're using a medication that you like and you will actually use. And that may need some adjustments with your doctor and insurance. So we'll talk about how to use meter dose inhalers. I've made some graphics for people that are more visual learners. And I also have some videos for those of you that are more auditory learners. So how to use an inhaler, take off the cap, check for debris. This is really important, and people skip this step, but if it's in your purse, it can be full of crumbs. I had a nephew that would carry his in his pocket, pulled it out, went to use it, and inhaled a big gob of pocket lint, which is the last thing you need to inhale when you're having an asthma attack. So Just check that quickly and make sure nothing's inside. Shake the inhaler, breathe out away from the inhaler. I'll show you this on a video. If you're not using a spacer, you need to breathe in for 1 to 2 seconds, then depress the inhaler. The reason why is the inhaler comes out so fast. Most of you know this. It's going to shoot to the back of your throat and you're going to swallow it. So when you start to inhale first, for lack of a better term, it sort of starts turbulence in your mouth and your throat, so you can pull it down to your lung. So remember, if you're not using a spacer, you need to inhale 1 to 2 seconds, then depress it. A lot of times they'll show people using 1 finger to depress it. I don't have the hand strength to do that. I have to use 2. That's just fine. Breathe in slowly for 3 to 5 seconds. Hold your breath 5 to 10 seconds, or really as long as you can. Breathe out slowly. And then wait 1 full minute if you need a second puff. So let's watch a video on this. This is from CDC. See if it'll, and it's not loading. Okay, we just tried this out, but
A metered
there we
dose
go.
inhaler. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Without the inhaler, take a breath and breathe out all the way. Hold the inhaler upright. Put the inhaler in your mouth, above your tongue, and between your teeth. Seal your lips around the inhaler. Begin to breathe in slowly. Press down on the inhaler 1 time and keep breathing in. Hold your breath for 5 to 10 seconds. Open your mouth and breathe out slowly.
Okay. So when you're working with patients, family members, students in your school, whoever you're helping, really gently correct them with their inhaler technique. You can see this doctor over on the left actually witnessed a doctor working with a patient, and the patient showed their inhaler technique. And then the doctor said, "Wrong," just like that, which is really offensive and a terrible way to treat a patient. So what I would do in my asthma home visit program is what this doctor is doing on the right hand side here is I would gently correct someone. So I'd say, "Oh, that looks good. And you're really, really close. There's just a couple of little tweaks that I can show you and you'll actually get more out of your inhaler. Is it okay if I show you that?" And they'd say, "Yeah." So please don't be this guy on the left here and yell at a patient or just be really horrible. Gentle correction is going to go a lot farther when you're trying to help someone if they just need to change a couple little things. So we'll talk about different types of spacers and holding chambers. Here's some photos on the left-hand side. These are mine. I have boxes of these things. Um, there's really mixed opinions about whether people think you need a spacer or not. I'm a big fan. You can see the guy here on the left that fell, that tripped over a cobblestone street. It can be really helpful for those of us that are not coordinated. I'm not coordinated. I'm so uncoordinated. I fell up the stairs coming in from my patio, got a concussion, missed 3 weeks of work. I'm really, really klutzy. The other thing that I really like is, especially if you have kids in school and they have soccer bags or backpacks, for people that have purses or messenger bags, it can be a lot easier to find your inhaler. This is a picture of my purse with all my junk in it with the spacer poking out. I actually had an asthma attack on the interstate and I was going about 80 miles an hour. There was no safe place to pull over. I was able to quickly grab it out of my purse because of the size, and my inhaler was already attached to my spacer, and I was able to use it. Safety recommendation. Don't recommend this, but you have to do what you have to do if you are having a hard time breathing. So don't just take my word for it. Last summer or last May, AFA did a Twitter chat with Dr. Stuckus, and they asked, "Well, why do I need to use a valved holding chamber? Aren't those just for kids?" And he answered, "Everyone should use a spacer with metered dose inhalers. You need to add space for the liquid medicine to turn into an aerosol. The best argument for a spacer is when they are treating EOE or eosinophilic esophagitis. They use the inhaled steroid without a spacer so that the medicine goes to their esophagus. So essentially they're swallowing the medication. So I'm a big fan. Some people don't like them. I'm a big fan. I think it takes out a lot of variables for people not using them correctly. So these are different spacers and holding chambers. The holding chamber on the left has a valve and an indicator to let you see the inhalation going. When you have the mask like that, you use tidal breathing where you breathe in and out 5 or 6 times. And so this little valve here, you can actually see it going back and forth. So if you're working with a small child, even older adults can use this. They have different sizes for the mask, and you can see it going in and out and make sure that they get all the medicine they need. If you hear a whistle sound, slow down. I had someone that said, "Oh, I thought that was a good thing. That meant I was using it right." And I said, "No, it's kind of like a warning. Like in soccer, they blow their whistle because you're doing something wrong. That's a little bit of a warning that you're breathing in a little bit too quickly. So slow down." So you don't want to hear the whistle sound. There's a lot of different spacers and holding chambers. Really, for me, it seems like it's whatever insurance covers or happens to send to the pharmacy for me. So don't assume that patients know how to use their spacers. During the pandemic, when I was doing contact tracing, I was working in our mass vax clinic, and about once or 2 hours a week, I would help someone in the asthma home visit program. I had a woman who pulled the inhaler apart, took this out, and put this into the end of her spacer. Never seen that before or since, but just know that some people just aren't quite sure how to do it. So what I started doing is this graphic I would tape to the box of any spacer. It shows a canister, plastic holder, the cap. That's step 1. Step 2, put it into the back, leaving it in the plastic holder. Step 3, shake it together. Show step 4, have them take a puff, wait that 10 to 15 seconds, 5, 10, 15, however long really you can hold it. And then make sure that if they're using a controller inhaler, that they're going to rinse their mouth out and spit that water out. So hopefully they don't get thrush. So great graphic that you can use with some of the people that you're working with. So created another little graphic for you, and then I'll also have a video. So basically the same step, except the third step here is you're just going to attach it to your spacer. So for you visual learners, this will be on the PDF if you need to take a look at this, if this helps you a little bit more. Let's see if this video will play. Seems a little bit slow. Oh, there we go.
Using a metered dose inhaler with a spacer. Take off the inhaler cap and make sure the mouthpiece and spray hole are clean. Shake the inhaler 10 to 15 times. Put the inhaler mouthpiece into the end of the spacer. Inhale a deep breath and breathe out all the way. Hold the inhaler and spacer between your pointer finger and thumb. Put the mouthpiece of the spacer in your mouth and above your tongue. Close your lips around the spacer. Tilt your head back a little bit. Press down on the inhaler 1 time and breathe in slowly and deeply. Breathe in all of the air you can and hold for 5 to 10 seconds. Open your mouth and breathe out slowly.
Okay, I'm going to cut off little sections of these because we might be short on time. So great video from CDC. Feel free to use that with anybody that you need to. We talked about thrush. There's a fungus among us. For anyone that's had this, this is really annoying. You get the fungus growth on your tongue. Your tongue can look white, can have little sores on your tongue or your cheeks. Sometimes you can have a loss of taste, or food might taste different. Sometimes your tongue might be sore, and sometimes you can get little sores that can actually bleed. They can treat this with an oral antifungal pill or a liquid. Prevention is the best on this. Once you get it, it can be really hard to get under control. So remember, if you're using that controller inhaler morning and night, to rinse and spit, and then brush your teeth and brush your tongue. So cleaning your spacer, these really should be cleaned once a week. You're putting this in your mouth. You don't want all those extra germs. A lot of us already have cranky lungs. You don't need any extra. So pull the pieces apart, swish it in hot sudsy water, soak it for 15 minutes in a little bowl or container, rinse all the pieces, shake off the water, air dry on a paper towel. Normally I would take the mouthpiece off. I was not feeling well that week and I couldn't get it pulled off. So not the end of the world, but make sure that you're cleaning those on a regular basis. So let's talk about dry powder inhalers. These are all dry powder inhalers, but they're all little different delivery devices, and they can be a little bit tricky to figure out how to use them. So this one, the Brio and the Trelegy, they're technically a COPD medication, but a lot of those medications can also be used for asthma. But since it is a COPD medication, it can only be taken once a day. It works for 24 hours. So make sure you know which medication that you're on. Advair, easiest way that we tell people is hold it like a cheeseburger and suck like a milkshake. So easiest way to help people with that. We do have a little video on this. Let's see if this one works.
How to use a discus dry powder inhaler. Check the dose counter on the side of the inhaler. Do not use if it says 0. 0 means the inhaler is empty. Level flat position. With the other hand, place your thumb on the thumb grip. Push your thumb away from you until it clicks.
You can hear that
You should
click.
now see the mouthpiece. While holding the device in a level flat position, use your thumb again to push the dose lever away from the mouthpiece as far as it will go until you hear it click. Prepare your body by sitting or standing up straight. Breathe out all the way away from the inhaler. Never breathe into the device. Tilt your head back slightly. Put the mouthpiece into your mouth between your teeth. Close your lips tightly around the mouthpiece. Breathe in quickly and deeply through your mouth. Remove discus from your mouth and hold your breath for up to 10 seconds.
So a couple things to remember there. You noticed how she had her dose loaded. She's ready to go. You don't want to exhale right into this device. Since it has that dry powder, there's a little bit of moisture in your breath. That can be enough to clog it up and cause problems with the dose coming out. And also notice that on the dry powder inhalers that you have to breathe forcefully, quickly, and deeply to get it out. There is no propellant in these inhalers. You're the propellant. Your body is the propellant, and you need to do a little extra work to get them out. And that's why these can be a little bit harder for younger kids and older adults. So that's that. Remember when you exhale to blow off to the side and not into it. And then close it up when you're done so you don't waste any doses. Wixella, this guy, when it came out, when I got my little trainer, I thought, what is this? And my kids said, Mom, that looks like an AT walker from Star Wars. So kind of does. And this is very different. You can see I've got a little circle on the slide there because you're not going to be holding it this way like Advair. This one's vertically and the mouthpiece goes across instead of this way. A little bit tricky. That's why I put a diagram on there. And then we also have a little video I will show you.
Pharmacist here at the Salt Lake VA. Today we're going to go over you were prescribed Wixella.
Okay.
This is an inhaler used for asthma or other chronic obstructive pulmonary diseases, also known as COPD.
Okay.
I'm just going to hand this over to you and walk you step by step how to use it.
Okay.
First, you're going to open the inhaler. There's a little grip on the side there, so just pull that down. Perfect. Your holder there at the bottom, just always keep that towards the bottom.
Okay.
Next, there's a yellow tab inside the inhaler. Pull that all the way down. You may or may not hear a click. Once it's all the way down, avoid closing it or maneuvering that lever.
Okay.
You may waste a dose if you do that. Now, before you inhale this medication, take a long, deep breath out. Try to empty your lungs. Then put the inhaler right to your mouth and inhale quickly and deeply. Perfect. Try to hold your breath now for about 10 seconds. If that's uncomfortable, just
Okay, similar as the other medications, notice it's just a little bit different orientation. It's that vertical
As long as you-
orientation. So another delivery device, same thing, same medication, a little bit different. And I know we're a little short on time, so let's see if we can get this going.
Inhaler is a device used to give asthma medications. First, wash your hands. Hold the Respiclick inhaler upright. The cap should be at the bottom. Open the cap until you hear it click. This primes the dose to get it ready. Turn your head away from the inhaler and breathe out all the way. Do not block the air vent with your mouth or your fingers. Put the inhaler in your mouth and close your lips around the mouthpiece. Take a deep breath in.
Same process. So just know it just looks a little bit different. Don't put your mouth far enough that you're going to cover that vent. So this one is very different and there's some assembly required. Remember, this is another one of those. This is the Respimat that's used once a day. Okay.
Press in
Now
the
you can see
safety
how to put it
catch on the
together.
side of the device to remove the clear base. Place the narrow end of the silver canister into the inhaler. Push it down on a hard surface until you hear it click. Once the inhaler is assembled like this, it is good for only 3 months. Be sure to write the expiration date on it. Put the clear base back on the inhaler. Next, prime the inhaler by twisting the clear base in the direction of the arrows until you hear it click, about 1/2 turn. Open the cap and push the button to dispense the medication. Medication may not be visible at this step. Repeat twisting the clear base, opening the cap, and pressing the button. Do this 3 times until a visible mist of medication can be seen. Point the inhaler away from your face and breathe out slowly. Twist the clear base and open the cap. Put the inhaler in your mouth and close your lips around the mouthpiece. Press the button.
So you can see the button is actually on the top there that you use to depress. One thing I noticed, I am not a morning person. As I mentioned, I'm not coordinated. So sometimes when I depress it, the mist comes out and catches me off guard and I will cough the medicine out. So for this, I also breathe in for about 1 second to get that flow going in my mouth, and then I use this inhaler. So if you're working with someone and they said, I just cough it out all the time, that might help them.
Button.
Biologics before the pandemic, they were mostly given in office, except for Syncare here, which is given by infusion. During the pandemic, they really expedited being able to get these all to self-inject. The thing with biologics, for those of you that are unfamiliar, if you have really severe asthma and you are in step 5 or 6 of the EPR3 updated guidelines, that means you're close to the top of the treatment chart, then you qualify for this. So your doctor will run a blood test, see what type of biologic is best for you. They all sort of work on different molecules at the cellular level. It starts way down deep in your body to stop or try to control some of that cascade from exploding. These all work on different IL-4s, IL-5s, IgE, eosinophilics, Tezi, that's kind of the new kid on the block, and it's the first biologic without a phenotype of biomarker limitations. So some people that weren't able to get on a biologic prior to this are able to use this one. So needle phobia is real. When I worked in our vaccine clinic, I would have grown adults come in just sobbing and hyperventilating because they needed to get an injection. So this is Monk. If you have ever watched the TV show Monk, the defective detective, these are the number of people that had to hold him down for an injection. You can have a nurse that will come out and show you how to use your self-injector. There is therapy, kind of exposure therapy that's available too if you're really struggling with trying to use a self-injector at home. These are different types of nebulizers. Most people will refer to just the entire thing as a nebulizer. We know that these two on the left, the big ones, are compressors. And then that's my little travel nebulizer there. So if you have one of these big old school nebulizers, this is Big Bertha. We've had her 24 years. She works amazingly well. Kind of like when you have an older fridge or freezer or stove, might not be pretty, but it runs literally for decades. That's what Big Bertha does. So don't throw it away if you have a big one like that. It'd have a great PSI to be able to deliver that medication. If it's too loud when you're using it, we always put ours on the carpet next to our kids' beds. You can put it on a hot pad if you're sitting at a table. Different ways of using these. I did a quick little Google search because there are so many adorable compressors that are out there now. They didn't have any of this when my kids were little 24 years ago. Most of these you're probably going to have to pay for by yourself. I doubt insurance is going to cover any of these. Down on the bottom, I put a couple of masks, fun little masks. My insurance did cover those when my kids were little to make it a little bit more kid friendly. Remember to wash your hands before you're using your nebulizer. It is medical equipment, and we want to keep it as clean as we can. Also remember, for nebulizers, it's not just for albuterol. That's all people use it for, but it can also be used for budesonide. If somebody needs to use that as their controller medication morning and evening, we had to do that for my daughter when she was a toddler. Twice a day, every day, she would have her breathing treatment with her budesonide. So that can be a great option. So this is a little graphic I found on Healthline, parts of nebulizers. Once again, you should have somebody come from home healthcare and really show you how to use it the first time, because if you haven't used one before, it can look a little scary. Also made another graphic for anyone that wants to see this, how to use a nebulizer. Basically, you pour your albuterol, or if you're using budesonide or something else, or duoneb, into your medicine cup. Then you attach either your mouthpiece or your mask, whatever you prefer to use. People have different preferences. Make sure that the tubing is connected to the compressor and then the medicine cup, and then turn on the nebulizer. Breathe in slowly till all the medicine's gone. Time can kind of vary depending on the nebulizer that you use, maybe 10 minutes for most people. Make sure like every 5th breath that you take kind of a deep breath. When you're done, turn off your compressor, and I'm going to show you how to clean that. Portable nebulizers, not covered on insurance. If you travel a lot, they can be really, really handy. They use a little vibrating mesh cup instead of the jet nebulizer, like the big nebulizers. Some run on batteries, some you can plug into your laptop and recharge. So they're really, really handy to have. So cleaning the nebulizer or your little canister kit, do not clean the tubing. That does not need to be cleaned. Do not try to run water in it or do anything else like that. So you're just going to be this little mouthpiece or the mask, and then the medicine cup. Really simple. Take them apart, use a little dish soap, put them in some hot sudsy water and make sure they're nice and clean, rinse, and then dry on a paper towel. Another option, you can sterilize it with 3 cups hot water, 1 cup vinegar. This is a heat method, and this can be for those that have a little more severe asthma, COPD, cystic fibrosis, and who have to be very, very, very careful about germ control. So these are some of the options that are mentioned through Cystic Fibrosis Foundation. Place in boiling water 5 minutes, microwave in a bowl of hot water for 5 minutes, use on the top rack of the dishwasher for 30 minutes. My dishwasher goes for longer than 30 minutes, so really check the instructions on your mask or your nebulizer. You do not want to melt it. So check the instructions and see how they want you to clean it. That's the heat method. There's also a cold method where you can either use isopropyl alcohol, tongue twister, or hydrogen peroxide. So the alcohol is a 5-minute soak. The hydrogen peroxide is 30-minute soak. Rinse with sterile water, not tap water. And then I always dry mine on a paper towel, and then I put it in a little Ziploc bag. Don't use a hand towel, it could be full of germs. So what if you can't afford your inhaler or really any other medication? I have used this website for years. We're a family of 5, 4 of us have asthma. This is called Needy Meds. So if you click right up here on the top left corner where it says healthcare savings, that little red arrow, you're going to have an option. This is the view from a phone. You can click on either brand name drugs or generic drugs. Pick whichever one you need that you're looking for. This one, brand name drugs, you're going to click on the alphabet list. For this example, I'm using Dulera. So you're going to scroll all the way down the D's till you get to Dulera. Click on that. You're going to have these icons pop out. So the pill icon, that's for information. Scissors, you could either use a coupon or apply for copay assistance. You got your little person there for extra support. You can play videos. You can click on the eye for additional drug information. My son, way back in the day, 2007, I think it was on one of the first biologics on the market. And we use this to apply for copay assistance. For 7 years, they paid our copays for his biologic. So highly recommend this. You can do the same thing with generic drugs if you still need help with your copay. The other really great thing is you can help friends or family members or neighbors, whoever, find free, low-cost sliding scale clinics. They have medical clinics, dental clinics, mental health, and substance abuse. I had to use this for a family member in Oregon, had just moved and didn't know where anything is. Click on whichever you need, enter your zip code here, do your radius, 5 miles, 10, 15, 20, however far you want to travel, and it will pop up all the clinics for your area. Really, really handy. So you can even help a family member in another state or friend or whoever. You may have heard about this on the news. The Senate Health, Education, and Labor, or the HELP Committee, is investigating costs for inhalers in the U.S. They're actually investigating the costs of many medications, about why they're significantly more expensive in the U.S. than they are in Europe. Give you an example. Here's a couple of things that they mentioned. That Advair in the U.S. is $319. In the U.K., it's $26. QVAR is $286 here in the US. In Germany, it's $9. And then this is the Combivent Respimat, $489 in the US and $7 in France. So be interesting to see how that goes and see what they find out. We're almost out of time. I was going to talk about asthma home visit programs. Highly recommend. They're all over the country. One thing I wanted to say, they're mostly run by people like me, public health educators, community health workers, or promotores. The reason they're run by these people is it's been proven to be effective because they'll open up to us oftentimes when they won't open up to someone in the medical community. So these are some of the resources we help them with: rent, food banks, utilities, transportation, home remediation, all these other resources. In fact, I just helped someone find assisted living for their family members, speech therapy, financial counseling. We cover the whole gamut. We know they're not going to focus on their asthma. They're cold, they're hungry, and they're about to be evicted from their home. None of that matters. And so we help them with all areas of their life. As Zan mentioned at the beginning, my life as an asthma mom, I'm not too shabby of a writer. I would love to go back and tell my English professor this from 1990. She said I was a terrible writer, and the blog has been consistently named in the best asthma blogs for a decade now, I think. So is she done talking yet? Yes, I'm done. I apologize. I know that was a lot of information. It was like drinking out of a fire hydrant. I wanted to try to get through as much information as I can. Zan, I'll turn it over to you and see if we have any questions.
So we're at 12:43. We have plenty of time for questions. Let me scroll the chat just to make sure I didn't miss anything. Folks are welcome to take yourselves off mute if you would like and ask a question out loud. Or if you would like to submit a question in the chat, you can do that. I'm also going to point everyone to the chat for information about the evaluation survey that's going to go out. I always send out an evaluation once I get the manifest registrants and participants from our Health Council colleagues. So as soon as I get that, I will get a SurveyMonkey survey out to everyone. And that's going to have a place where if you want your continuing education credit for this webinar, you can submit your information to make sure you get your CEUs. So look at that info in the chat if you have questions. We want to make sure you get your credit if you want credit for today. I see Bruce. Hi, Bruce. Bruce is saying great job. And then we also have a couple comments from Wanda and from me just about nebulizer technique and sterilizing your equipment. So I have one of those big baby bottle sterilizers that I use for my devices, and it works great.
I should have added that in. Someone else mentioned that. I forgot to add that
in.
Almost
everyone I know in the CF community has one of two different types of large microwave baby bottle sterilizers. It's like we all have certain equipment.
Yes, absolutely.
All right. So I'm
And,
seeing accolades for you in the chat. Wanda, did you have a
Thank you.
comment?
yeah, I just the comment that I put in there, Andrea, I don't know if you heard this, but I heard this maybe a couple months ago. It was a pediatrician that was trying to help the parents with asthma control in their toddler, which obviously cannot use a, they didn't have a spacer or, well, yeah, not a spacer or anything like that. And they were using a nebulizer, which is, totally fine. And so they go to a visit, and the doctor said, how's the new medication? Because he has switched to MDI. And the mom says, it's not working. And she said, why is not working? I said, well, I'm putting this in the nebulizer and it's not working. So she was puffing the medication into the nebulizer cup. So again, it just tells you, what you just said here during this last 45 minutes. You don't assume that people know what to do. You just teach them. Because we see things that in our wild dreams we never thought that it would happen, and it will. So it's such important, the education, and that's one of the things, that we want to always emphasize. And again, thank you for your time.
I'm glad you mentioned that. And that's why I put so many graphics in there to show each step. And I thought, I don't know who's going to be on the webinar. If we have physicians, respiratory therapists, nurses, we just have parents of kids with asthma. So I wanted to make sure that the information is really basic, because there's a lot. 24 years ago, when our world changed, I just didn't know what I didn't know. And so there's a lot that I wish I've known back then. So that's why I tried to keep everything really basic. A lot of you, if you knew all that, close your eyes, grab a coffee, whatever. But I wanted to put things on there because it's amazing how this does happen. Things that we deal with every day, it's second nature. We can do in our sleep. People are seeing it for the first time and don't know how to use it. So, you know what, sorry, I thought I was took too much time. I wanted to go back to these asthma home visit programs. Really cannot focus on these enough. So when I would work with physicians, I would say, you diagnose, you prescribe, you educate, we'll come in behind you and we will reinforce what you have educated. And then we can spend an hour with them going over questions and teaching them. So we made such a difference when we ran this program, and here we have this in my state in Utah. So I wanted to highlight some of the outcomes of this. So we are saving people 80%. There's an 80% decline in missing work days. And a lot of people, when they're missing work, they're getting fired from their job because they're missing too much work because of asthma. 51% decline in kids missing school that are falling behind and start to get into trouble. 41% reduction in unplanned doctor visits. You wake up in the morning, the kid's hacking up a lung, you're trying to get into the pediatrician, or you got to go in after hours. 51% reduction. We know oral systemic corticosteroids can have long-term side effects with bone thinning, with glaucoma, with other things. So being able to reduce those. And then these are what's most exciting, really. 75% reduction in asthma ED visits. Those are traumatic. They're really scary, as well as asthma hospitalizations. 87% reduction in asthma-related hospitalizations. As a mom of 3 kids with asthma, my kids were in the hospital 12 times, 2 ICUs. As I mentioned, it wasn't any missteps on our side, is that I had this son with this really severe asthma, and we had to wait till Xolair was available. At the time, my son had to get to be 12 years old to be able to start on that. Completely changed his life. Completely changed our lives. He was not in the hospital again after that. So asthma changes so quickly. All the medications change quickly. I had to do a lot of research on this to make sure I was up to date on everything that's coming out on the market. So really, for all of you family members out there, pat yourself on the back. You're doing a fantastic job. It's really hard to stay up on all of this. So that's why I've done it for you, to try to keep you updated. Please reach out if you have any questions. Highly recommend an asthma home visit program just to give you that extra help that you need in your home. And if you need to keep trying different medications, keep trying them until you get on the one that's right for your body. For all 4 of our family members, we're all on different treatment plans. All of us all have different inhalers, different treatment plans. So you got to find out what's right for your body.
That is awesome advice. And I am seeing in the chat another specific accolade, Andrea, for your graphics. Gail is saying in the chat that they are excellent for low literacy. So you've got folks interested in spreading your materials, which is, I'm going to echo that feedback. Your graphics were terrific.
Thank you. That's why I created them. Pulling on a little
They're
of
good
my
on
design.
the contrast as well for visual accessibility.
Thank you. Thank you. That's why I tried to create them. Feel free to take them and use them. Absolutely.
Beautiful. And we also have a reminder in the chat from Tiffany from the Health Council about our upcoming summit, which will be held with both in-person options at Lakeland Regional Health and a virtual participation option for those who want to attend via live stream. So you can check out that information in the chat. We encourage you to nominate asthma champions as well using the form linked in the chat. I am not seeing questions yet in the chat. Some more accolades, though, for your presentation and for results from some of the stories that you shared. So let me open it up and ask if there are questions for Andrea. We still have a few minutes.
You know, I'd highly recommend the asthma summits. I'm clear on the other side of the country. I listen to the Florida asthma summits virtually every year. The world of asthma moves so fast. It's really important to stay up on things and to get different perspectives from different presenters. Highly recommend. It's free. Will be a great use of your time. Absolutely. And I know it's recorded, so I would go back and listen to sessions as well. Really helpful.
Wonderful. And we are very glad that we've been able to open up that opportunity to participate in our summits to folks outside of Florida. We've actually gotten a good portion of our participation from folks elsewhere in the country these past few years. So that's been a really exciting change for us. I see Tiffany has placed the PDF of the summit flyer in the chat as well. And of course, if anybody has questions about the summit or you're struggling with your registration, just send an email to floridaasthmacoalition@gmail.com. That same address you saw in all the materials to register for this, and we will help you out. Watch the chat for questions. Folks are also welcome to unmute if you would like.
You know, Zen, I was just thinking, I have all of my empties, not those kind of empties, like these empties, spread out on my desk here. And one that I didn't show, I don't think I had a video for this device. So this one, you just put your thumb right there on the ridges, pull it down, and then same thing like the Advair, hold it like a cheeseburger, suck like a milkshake. You've got your mouthpiece there. Remember, with all these dry powder inhalers, to exhale off to the side. And then, oh, the other thing I was going to say about when you are helping people with their inhaler technique, if they're struggling, I always would tell them, you are in good company. Over the years that I ran the asthma home visit program, I had one participant that had correct inhaler technique. Nobody else did. A lot of people were really close. And really, I put that graphic in there this morning because it's not going to help you at all to shame someone or make them feel bad. So just gently correct them and then step back with them. Check back if you have a visit 2 weeks later or however much later it is if you're doing asthma home visits, and say, how's that working? Do you feel like you're getting more medicine? They're like, yeah. I mean, I had no idea that I just changing a couple little things could really help. So those CDC videos are great. There was also let's see if I can minimize my screen. One thing or maybe stop sharing. There's a great video and it's called Oh, let me see if I can find it. It's Abraham, the pharmacist. So he started, if you ever follow him online, he has great videos. He shows how to use an inhaler, how to use an inhaler with a spacer, and he's really fun. He does it kind of in the style of TikTok. Not to knock CDC, their videos can be a little bit boring, but he does a great, he does sound effects and really fun things. So he's someone great to follow. And not only just for asthma, he'll talk about all sorts of different medications that are on the market, different things to help people with their health. So Abraham, the pharmacist, he's from the UK. He would be somebody really great to use some of their videos. Oh, and the other thing I didn't put in here, but that we used quite a bit, is we would always use the house video. So Wanda, as you mentioned, everybody's laughing. We've all seen that one. But we has the woman and he says, show me how you use it. And she goes like this and she squirts it like perfume. So, sounds crazy. We've all heard stories about that where people just, they mean well. They'll show the spray. I've seen where a pharmacist would just spray it on his wrist to kind of show him, or put the spray, show it like this, and it went in his ear. So there was this woman that came back with earaches. She was spraying this in her ear. So, as crazy as this sounds, people aren't getting the basics, and that's why I wanted to roll it back and make those graphics. So make sure when you're showing someone, even though this is empty, it still has propellant in it, so I can still use it as a demo to try to show people. And then I try to always pick up whichever one, as I mentioned, all my empties here, whichever one I actually have. Which the device that they're on, I would show them. And another thing I've also seen, and sometimes they'll make graphics and the inhaler will be upside down on a graphic because they think it looks cool. Like, don't do that. I had a coworker come up to me and say, yeah, this never works. I can never get anything to come out of it. And I said, oh, well, is that how you hold it when you use it? And he's like, well, yeah. Well, it was upside down. We want it up like this, people. So people that make graphics, stop putting inhalers upside down. They do not go like this. They go like this. So yeah, you're going to see some really crazy things out there, and just say, oh, well, it works a little bit better if you just flip it around a little bit. Can have a little bit better use that way. The other thing I wanted to mention, I know everyone's different, as I mentioned, and everybody does medication differently. So this is one that I mentioned at the very beginning. That's one of the albuterol inhalers. I mentioned it's a little bit chunky, a little bit chunkier than a normal inhaler, because it's a dry powder inhaler. So I know a lot of people really struggle, myself included. I cannot use this when I'm having an asthma attack. I can't inhale enough. I'm usually coughing so hard I'm trying not to throw up. This isn't going to work for me. And so, like I said, everybody's different. So make sure that you're using the one that works for you.
We have a question in the chat
Yes.
from Wanda. How do you respond to people who say, I don't like the taste, so I don't use my inhaler?
And that can be one of those other things I talked about. That woman in Hawaii that wouldn't use this and was using her inhaler 5 or 6 times a day. So I said, hey, here's another option. So if you're not going to use it, please switch. Please talk to your doctor. Please see what else is covered under your insurance. Get on one that you're actually going to use. If you don't, I'm not going to use it either. If there's this that I stopped using because I couldn't use it. If you don't like the powder, that's not uncommon. I've heard that quite a bit. For some people that really bothers them. Please get on something else that works for you.
So I have a question for you, Andrea. What warning signs would you encourage people who use inhalers to watch for about the medication running out before the counter is fully down at 0? Because I know I've had this issue, especially with some of the earlier MDIs for my corticosteroids, and it can be really frustrating.
It can, and sadly, I've done this where I didn't even check the counter and it was empty and I was on a work trip. And so I noticed an increase in symptoms. So for me, that was my sign. I started coughing. I started having the tight chest and I thought, what, the pollen hasn't changed. Nothing's changed. What's going on? So I pull up my controller inhaler. It's empty and I don't know how long it had been on 0. So if you notice a change in symptoms, maybe it's run out early, maybe it's empty, you didn't get it refilled on time. change symptoms. So for me, I had an increase in coughing. I was waking up at night
Yeah.
coughing, which is highly unusual for me. I had more of a tight chest. I was getting a lot of, for me, I call it kind of a twitchy throat, kind of itchy or
Yeah.
twitchy throat. I noticed an increase in symptoms. So if that happens, check your inhaler, make sure it hasn't run out. And it can be hard to tell because the propellant will come out even though
Right.
there's no medicine in it. And I've had somebody
Yeah.
go, because I said, oh,
Oh
well,
yeah.
you know, it's on 0. And he's like, did you see that? And I'm like, oh, well, you know, it's kind of tricky. Once again, gently correct someone. I said, well, it's kind of tricky because there's still propellant in there. So that's what's
Oh
coming
yeah.
out, even though it's not mixing with any medicine. So yeah,
Yeah.
if you see an increase in symptoms, check your inhaler, make sure that it's still going.
And I've had that happen sometimes, even when my counter is still up at like 20 or 25, because they're still perfecting the MDI technology. And it's like, if I'm only tasting propellant, that to me is a big sentinel that, wait, I need to maybe switch to a fresh one.
I've heard that. I've heard people say
Yeah.
that it runs out before it's actually empty.
Yeah, and it's a big issue with certain medications, and having the MDIs is great because when that counter is high, the way that it distributes your dose and really lets you make the most of every puff is fantastic. But this has been an issue with some of the medications I'm on. It's like my counter's at 25. Why am I starting to have more symptoms? And
Yeah. You know, and one thing I wanted to bring up is you know, we don't act like a textbook. And
yeah,
medication doesn't act like a textbook. And I know
not at all.
people follow the textbook. Here's what should happen.
Yeah,
And here's how it should work. I'm not a textbook case for anything. You know, I can't tell you how many times I've been in the ER and they said, oh, well, you're not wheezing. And I'll say, "Oh,
yeah,
I don't wheeze. Don't look for that for one of your variables. I'm not a wheezer. And invariably they'll say,
yeah.
well, you're fine because you're not wheezing.
Oh
So
yeah,
not only as patients are we not textbook, but some of the medications don't work like textbook. They've had
yeah.
studies done. They should work perfectly. You know, it's not a perfect world, and sometimes things don't work as they should.
Oh, that word "should" kills people in medicine. I've been teaching doctors for a long time. If you don't respond to what is, you're not going to be able to show up for your patient, regardless of your clinical specialization. And
Yeah.
I love that advice about really knowing your body and knowing your
Mhm.
symptoms. Like I know what my warning signs are that I'm developing pleuritic inflammation. That's that inflammation in the wall of your lung
Right. Right.
that can really compress your small airways, even if
Yeah.
there's no obstruction. It's like I might not be wheezing. A lot of people with CF don't wheeze very much, but we have an oximeter, and if that number is going down of how much oxygen's in your blood, something is wrong.
Right. And another thing, I mean, we need to look at the whole picture. I have a friend that's
Oh yeah.
longtime RT, about 20 years, and she said, I've intubated people that were 94,
Oh
95
yeah.
on the
Yep.
oximeter. And so you can't just look at
Yeah.
that and go, oh, well, you're fine. And I've had that
It's
happen
all
as
about
well.
what's your line.
Yeah, I mean, I
I'm
was to the
95, great for me, but
Well, and I was at the
a
point
little
where
different.
I was having clipped speech. So the California fires were going
Oh yeah.
crazy 1,000 miles away. We get the smoke, and we
Yep.
were at purple air quality days, so
Ooh.
hazardous. I had
Yep.
got caught in a building that didn't have good ventilation, and it started to suck in the wildfire smoke into this building. I was at Habitat for Humanity.
Yep.
By the time I got out there, got a lungful in my car, and got home to all my air purifiers, had
Yep.
done enough damage. I just started to get worse and worse and worse and worse.
Yep. Same. We
And
have the
then,
smart air
yeah, and all of a
purifiers in
sudden I
every
started
room.
realizing that I was clipping my speech, and I thought, this is what I teach people. I should not be taking a breath
Yep.
in between. So I'm at the ER, and the nurse, oh, your O2 looks fine. And so I point to my husband, and on the way over, I was just gasping, and I said, speak for
Yep.
me. So I would just point to him, and he'd say, she's a certified asthma educator. This is what she teaches. She's been doing this for almost 15 years. She knows what she's talking about. She's not a wheezer. She's got clipped speech, and he would have to actually be my voice. And so that's another thing I would also recommend, is make sure that you have someone with you if you're at the doctor
Oh
or
yeah.
at the ER at your worst. You need somebody to speak up when you literally can't speak up because
Oh yeah.
you're gasping.
And your medical proxy's contact information on a medical bracelet.
I
That's
have that.
my spouse's number on the back of it.
And I also have it on my phone. I have it
Yeah.
listed as
Yeah,
ice in case of
the
emergency.
medical feature in the iOS or an
Yes.
equivalent thing in Android is
Yes.
awesome. I have so much information in there.
You know, and I always tell people, you never know when you're going to need it. Another thing in the
Yeah.
asthma home visit program, I would say, what insurance do you have? Do you know which hospital's covered? And they'll say,
Yeah.
no. And I'll say, okay, well, there's 7 hospitals in our county and they're on different networks. So before I come back in 2 weeks, let's have you look up and see which hospital is covered. And I said, know how to get there.
Yeah.
The last thing you want is, 3 o'clock in the morning or whatever when you're not feeling well, and God forbid you're trying to drive yourself to the ER. Know how to get there, know the fastest way. They just reconfigured our hospital, and so you enter on a completely separate side. And so that's thrown a lot of people off. So know where your hospital is, know what's covered, know how to get there. Take someone with you if you can. If not, have them try to meet you there as soon as possible and really advocate for you. Really, really important.
Mhm. Absolutely. I think it's easy to forget also that we're not in our challenges alone, and that we can rely on our people, to help us. Even if
And
we're not unconscious, just sometimes having that support, it makes the difference.
it's the group that it's your chosen family.
Yes. Oh, I love
Doesn't
that
have
you
to be
use that
family
language.
members.
It's very
Neighbors,
resonant.
neighbors, coworkers. I have my
Mhm.
found my chosen family, my found family, and that's who those are my go-to people. Had a
Absolutely.
brother in the ICU this weekend, and I know who I could go to for help and to chat and to kind of vent and decompress too. Yeah.
Absolutely. Well, Andrea, I want to thank you. You've gotten a lot of glowing feedback in the
Oh,
chat. Very well
thank you.
deserved.
Thank you.
This was fantastic, and you've given us a lot of good takeaways, and we just so appreciate you being here with us today.
Well, thanks for putting up with me and my goofy personality.